In this video, we will be practicing with some questions, and I discovered this app, and trust me, almost all of the questions on this app I saw in my exams. So for those of you who don't know, CBT is merely competency based test, not computer based test. It's competency based test that the NMC requires for internationally trained nurses seeking to practice in the UK. So without any much delay, let us go straight into the questions. Okay, so the first question says the UK regulator for nursing and midwifery professions within the UK with a started aim to protect the health and well-being of the public is A. GMC, B. NMC, C. BMC, D. WHC. It's actually funny because where I used to work in Nigeria was BMC, but the answer to our question is NMC, that is the Nursing and Midwifery Council of Nigeria. Next question says, what is the role of NMC? A, to regulate hospital or other healthcare settings in the UK. B, to represent or campaign on behalf of nurses and midwives. C, to regulate healthcare assistants. D, to regulate nurses and midwives in the UK to protect the public. D is the answer because Nursing and Midwifery Council entails both nurses and midwives. Next question says, under the Carers Equal Opportunities Act 2004, what are carers entitled to? A, to their assessment. B, financial support. C, respite care. D, all of the above. Your answer should be all of the above because as a carer, you are entitled to everything. Now, the next question says, NMC requires in the UK how many units of continuing education units a nurse should have in 3 years? The answer should be 35 units. So the next question says, a patient assessed as lacking capacity to make their own decisions, what government legislation or act should be referred to? That should be the Mental Capacity Act 2005 because this has to do with one's mental capability. So the next question says that how many steps to discharge planning were identified by the Department of Health 2010? That should be 10. So the next question says, which law provides communication aid to patients with disability? So the correct answer to this question is B, Equality Act, and that is because people with disability need to feel equal with their peers. Yeah. Next question. Hearing aid provided to client comes under which act? That would be Communication Act because this one doesn't really have to do with disability or not. The next question says that a person supervising a nursing student in a clinical area is called A, supervisor, B, preceptor, D, interceptor, D, mentor. The answer is mentor. I know you may want to say supervisor, but it's mentor. Training of student nurses is the responsibility of all registered nurses. That is C. When you tell a third year student under your care to dispense medication to your patient, what will you assess? You are assessing his or her competence and skills. And that is not just, their ability to give medication, but their competence and skills. Okay, so the next question says that the charge nurse is accompanied by fourth year nursing students. It is his or her responsibility to allow students to give meds or have direct supervision or assess competence of students or get consent of the patient. So it is to assess competence of students. Okay, then the next question, guys, it says, to whom should you delegate a task? It is to who is competent, not someone you trust or someone you work with regularly, someone who is competent. So the next question says that which of the following is an important principle of delegation? A, no transfer of authority exists when delegating. B, delegation is the same as work allocation. C, responsibility is not transferred with delegation. D, when delegating you must transfer authority. I think the answer should be that delegation is the same as work allocation. Let's see. And yes, it is correct, guys. So the next question says, which staff type is expected to measure and document vital signs? A, student nurse. B, volunteer nurse. C, practical nurse. D, registered nurse. Our answer should be registered nurse. What is meant by an advocate? Someone who develops opportunities for the patient. B, someone who has the same beliefs as the patient. C, someone who does something on behalf of the patient. D, someone who has the same value as the patient. That should be someone who does something on behalf of the patient. No. Advocate. Someone who does something on behalf of the patient is your right answer. The nurse explains the surgery and discusses the patient's wishes with the family. The nurse is acting as patient's advocate. I don't need to go through the rest, you should know. Which of the following is not one of the 6 fundamental values for nursing, midwifery, and care staff? It should be consideration, of course. First option says care, B, consideration, C, communication, D, compassion. It's consideration. So let's go to the next question. A patient developed pulmonary edema because the nurse forgot to administer furosemide. Which legal element can the nurse be charged with? A, assault, B, slander, C, negligence, D, battery. So assault is like you beating someone, slander is like a verbal abuse, negligence is you ignoring to do your work, battery is the same thing as assault, so negligence is the answer. According to the Nursing Code of Ethics, the nurse's first alliance is to the client, or is it client and his family? No, I think it should be client. A, client and his family. B, client. C, doctor. D, organization. Client. Yes. The next option says, which option best illustrates a positive outcome for managed care? A says involvement in political process, reshaping current policy. C, cost benefit analysis. D, increase in preventive services. This is basically saying like, which option best illustrates like a positive outcome of a care that is like positive. So I think it should be increase in preventive services. Yeah. Which strategy could the nurse use to avoid disparity in healthcare delivery? A, recognize the cultural issue related to the patient care. B, request more health plan options. C, care for more patients even if quality suffers. D, campaign for fixed nurse patient ratios. So to avoid disparity, we need to recognize individuals' cultural differences. So I would say recognize the cultural issue related to patient care. Hopefully it's right. Yes. What are essential competencies for today's nurse manager? Strategic planning and design. B, self and group awareness. C, a vision and goals. D, communication and teamwork. Of course, communication and teamwork. Group members are unwilling to participate in making decisions. Which leadership style should the nurse manager use? Of course, we know that this is talking about management and leadership skills. So we have participative, B, authoritarian, C, laissez-faire, D, democratic. So of course we've given them the opportunity to make a choice, a decision, but they are not willing to. Participative is the same thing as democratic, which makes us left with 2 options to choose from, which is authoritarian and laissez-faire. So the right answer is authoritarian because laissez-faire is like the easy kind of leader. Number 25. What are essential competencies for today's nurse manager? I think we had similar option to question earlier. So just use communication and teamwork. Yes. The famous 14 principles of management were defined by, you should know this. Anyway, option A, James Watt. B, Adam Smith. C, Henry Fayol. D, Elton Mayon. Answer is Henry Fayol, of course. Next question. When proliferation starts after, proliferation is basically like when the tissue starts coming up, I think. Yep, that should be 3 to 24 days. No, 1 to 5 days. Anyway, let's choose this and see. 3 to 24 days. Okay. Yes, the correct answer is 3 to 24 days. Post-surgical wound is assessed and is found to be hot, tender, and swollen. This means that there is inflammation. So the wound is what? Well, in the inflammation phase of healing, in the hemostasis phase of healing, in the reconstructive phase of wound healing as an infected wound. In the inflammation phase of healing should be our answer. Let's see. Yes. How long does the inflammatory phase of wound healing typically last? I think that should be 1 to 5 days. Yes, correct. What stage of pressure ulcer includes tissue involvement and crater formation? That should be stage 2. Okay, the next question says a client's wound is draining thick yellow material. The nurse correctly described the drainage as purulent, of course. You can go ahead and I don't want this video to be too long, that's why I'm not bothering to explain the remaining options, because you know you can check more about the other options if you are unsure which answer to choose. Which solution used minimum tissue damage while providing wound care? So this solution sort of causes minimum tissue damage. Option A says hydrogen peroxide, B says povidone iodine, C says saline, D gentian violet. I think it should be hydrogen peroxide. Saline, okay. Well, let's go to the next question. How much urine should someone void an hour? 0.5 to 1 ml per kilogram per hour of the patient's body weight. Another one says 2 mils per kilogram per hour of the patient's body weight. Another option says 30 mil. Another one says 60 mil. So what's the correct answer? Yep. Let's go to the next question. Patient usually urinates at night. Nurse identifies these as polyuria. Oliguria is scanty urine, right? Dysuria, that's like pain in urination. Nocturia is, I think our option should be nocturia because it has to do with night. Let's see. Yes, let's go to the next question. All are risk factors of coronary artery disease except being a female. But option A says obesity, C, another one says smoking, C, female, D, hypertension. So our answer is female. Which sign or symptom is a key indication of progressive arterial insufficiency? A, edema, B, hyperpigmentation of the skin, C, pain, D, cyanosis. Our option should be cyanosis. It's pain. Okay. Orthostatic hypotension is diagnosed if the systolic blood pressure drops by how many? So our option should be 20. Shortness of breath and swollen legs may indicate. So our option should be right-sided heart failure or renal failure. Right-sided heart failure. Okay. Yeah, it shouldn't be renal failure because renal failure means all the body would be. So our answer is right-sided heart failure. That means, because the blood is unable to go back into the heart and be drained and all that, then it can be renal failure because renal failure would mean that all the body should be swollen, like puffy face and all. So, which is the first drug to be used in cardiac arrest? Atropine or I'm not too sure about this, so if you know it, leave it in the comment section, but I will just choose atropine for this time. Adrenaline. Cardiac arrest. Okay, we don't use this in Nigeria, but adrenaline is like to boost the function of the heart. Cardiac arrest is like when the heart stops working, so that should be adrenaline. Let's go to the next question. Why are support stockings used? Support stockings are like tight kind of stockings. I would put an image for you to see. It's like this leggings, but like it's very tight. Mostly used for people who have like swollen legs, but it's not like those with just edema, like probably those with varicose vein and all. So option A says to promote arterial flow, B says to aid mobility, C says to aid muscle strength, and D says to promote venous flow. Yep, D is our answer. Common signs and symptoms of a hypoglycemia exclude, that means it's all except A, ketoacidosis, B, feeling hungry, C, blood vision, D, sweating. We know it's ketoacidosis because that's like a, like this one is caused due to diabetes. It's diabetes that causes ketoacidosis. A diabetic patient is trembling and stating they are dizzy. The nurse should A, administer metformin, B, give orange juice, C, check blood sugar, D, call the doctor. Of course, you have to check the blood sugar first because the patient is diabetic before you know the next course of action. Yes, that's our right answer. And if you want to have this app, it will be at a cost of 10,000 naira. So just leave a comment or message me on Snapchat and let me know. Which of the major theories of aging suggest that older adults may decelerate the aging process? Honestly, I can't remember, but I think that should be Activity theory. Yes. Okay. Tuberculin skin tests to clients suspected of having TB will reveal a duration of TB infection. No. Active TB infection, latent TB infection, whether the client has been infected with TB bacteria. I think our option should be D. A normal sign of aging in the renal system is A. Intermittent incontinence, B. Concentrated urine, C. Microscopic hematuria, A decreased glomerular filtration rate. We know it's a decreased glomerular filtration rate. What medications would most likely increase the risk for fall? What this is basically saying is like which kind of medications could make someone have high tendency of falling. That is medications that could cause like dizziness and stuff. So probably beta blockers. Hypnotics is the correct answer. Why is pyrexia not always evident in the elderly? So I think it's due to mature T cells. Our option says A due to immature T cells, B due to mature T cells, C due to immature D cells, and D due to mature D cells. Due to mature T cells. Due to immature T cells. Why am I getting this wrong? Yeah. Which of the following displays the proper use of Zimmer's frame? Now, Zimmer's frame is, that thing that elderly people push, and I'm going to like attach an image for you to see. So what this is basically is like what is used in aiding walking. So okay, the correct answer is 4-point gait. Let's go to the next question. The nurse determines the client understanding on crutch walking technique is good if client does dash A written examination, B written explanation, C return demonstration, oral explanation should be return demonstration. The most advanced gait used in crutch walking is, I'm going to attach the picture of a crutch so you guys will see. So our answer is swing through gait. The next option says the nurse should adjust the walker at which level to promote safety. It should be at the hip level. Yeah. The patient can be selected with a crutch gait depending on the following apart from patient's physical condition, B body balance, coping mechanisms, arm and trunk strength. So it should be apart from coping mechanism. What is abduction? This one is basically talking about like moving something, your arm away from yourself or to yourself. You all know what the answer is. What is the clinical benefit of active ankle movements? I'm not really sure, so I'll just select all of the above. Okay, right. The most commonly injured carpal bone is fusiform or scaphoid. The carpal tunnel syndrome is caused by compression of which nerve? So our answer is median nerve. What degree angle should the patient be in during enteral feeding? That's like people being fed either through NG tube or something. Yes, our answer is 45 degrees. An overall risk of malnutrition of 2 or higher signifies high risk of malnutrition. Constipation needs to be sought out during implementation. I'm guessing this is during a nursing care plan. The correct answer is assessment. So what may not be cause of diarrhea? Food allergy can cause diarrhea. Food or intestinal obstruction. Patient's BMI is low. Where will you refer the patient? So these are like things how it's done in the UK. So it's obviously a dietitian. A COPD patient is about to be discharged. What is the best health teaching to provide to this patient? COPD is a chronic obstructive pulmonary disease, if I'm right. So the first one says increase fluid intake, B do not use home oxygen, C quit smoking, D nebulize as needed. I'm not sure if the person is smoking or not, so I'm a bit split between quit smoking and nebulize as needed. So I'll just choose quit smoking. Okay. In normal breathing, what is the main muscle involved in inspiration? That's breathing in. That should be What percentage of air we breathe is made up of oxygen? That's 21%. Yeah, 21. Patient puts out his arm so that you can take his blood pressure. What kind of consent is this? What do you have to consider if you are obtaining a consent from a patient? A, understanding. B, capacity. That's like their mental capacity, which we talked about earlier. C, intellect. D, patient's condition. So we're just going to choose capacity. After performing liver biopsy, the nurse places the patient in which position? The liver is on the right side. The patient should be on the right side so the liver doesn't hang. What is the preferred position for abdominal parenthesis? That should be supine with head slightly elevated. Early ambulation prevents all complications except ambulation. What does ambulation mean? Is that not to move someone? So it has nothing to do with surgical distance. So that's our answer. Which therapeutic communication technique is used in nurse-client interaction? That should be formulating a plan of action, making observations, okay? Yeah. When communicating with someone who isn't a native English speaker, which of the following is advisable? Using a translator. B, ask doctor, relying on friends or families. D, use the word clerk. That should be relying on friends or families or using a translator. CQC describes compassion as what? CQC is like what they basically do is to ensure that they are like the NAFDAC of the UK, like they ensure that all hospitals are within quality and standards. So they describe compassion as a creative commitment or gifted courage, intelligent kindness. Which of these is not a symptom of ectopic pregnancy? There shouldn't be bleeding, right? I'm not too sure. I'm not a midwife. Okay, vomiting is the answer. Which of the following is not a risk for ectopic pregnancy? Alcohol abuse is the answer. Severe bleeding after 48 hours following labor. What stage of postpartum hemorrhage is this? That should be emergency or secondary. Which of the steps is not involved in Tonkham's group formation theory? Now, this is something that we probably have heard before in School of Nursing. So there's like norming, storming, forming. I think it's accepting that it's not there. Yeah. Which is not a stage in Tonkham's theory of contingency? Okay, this is a different question. Forming is the answer. Which nursing delivery model is based on a production and efficiency model and stresses a task-oriented approach? This should be case management or functional method. Clostridium difficile (C. diff) infections can be prevented by using hand gels, washing of hands with soap and water, washing hands with soap and water. Patient with C. diff has stools with blood and mucus due to which condition? Ulcerative colitis. Which of the following modes of transmission is good hand hygiene a key preventive measure? That should be droplet. Wait, it's either droplet or direct and indirect. Let's go for all of the above. Correct. Except which procedure must all individuals providing nursing care must be competent at? Aseptic technique, disposal of waste, use of aseptic technique. The highest risk for a bacteremia is the client with peripheral inserted central catheter line, central venous catheter, implanted infusion port, peripheral intravenous line, the central venous catheter. What color bag should be used to dispose offensive hygiene waste? It's yellow with black stripe. For which of the following modes of transmission is good hygiene a key preventive measure? We've done this earlier. That should be all of the above. Which of the following are not signs of a speed shock? That should be peripheral edema. Which is not the sign or symptom of shock during early stage? Acidosis, hypoxemia, hyperventilation, tachycardia, hypotension. I'm a bit split between acidosis and hypotension, but I'll go with acidosis. After lumbar puncture, the patient experienced shock. What is the etiology behind this. Lumbar puncture simply means taking out part of the CSF, which could increase the intracranial pressure. Okay, I think that should be increased intracranial pressure or headache, CSF leakage, okay? Why the answer for that previous question, CSF leakage, is not this thing, not headache or any other things, because etiology is simply asking, like in layman language, like what is the cause, what happened. So the following are signs and symptoms of hypothalamic shock, except hypothalamic. This means low. No strong pulse, yeah. Pulse will be weak. What is not a sign and symptom of speech shock? Peripheral edema. When communicating with children, what most important factor should the nurse consider? Non-verbal cues, developmental level, physical development, parental involvement. I think it should be parental involvement. I'm not so sure. Let's see. Non-verbal cues is correct. Normal heart rate for a 1 to 2 year old is between 80 to 130 bpm. The following are all signs and symptoms of respiratory distress in children, except the answer should be lying supine. Management of moderate malnutrition in children should be weekly assessment or supplementary nutrition. Okay, document intake for 3 days. After 15 minutes of blood transfusion, patient develops high fever and loin pain. This may indicate adverse reaction, severe adverse reaction. How frequently should we observe a patient receiving blood transfusion? At start and quarter hourly till end. Where is revision on the nursing process done? Revision, that's like when you are checking out what is being done. Yeah, revision, that is like when you talk, like when you see what you have done, like how well did you do. Yeah, that should be evaluation. When do you plan discharge? I'm not so sure about this, so I'll just use 36 hours. Okay, 24 hours. Nursing process is best illustrated as individualized approach to care. Yes, nursing care should be caring medical and surgical patient. It should be patient-oriented, individualistic care. When you see problems or potential problems, when do you see problems or potential problems? That should be assessment. How the nurse assesses the quality of care. That should be, I think, all of the above. Yep. Who has the responsibility for the safety and management of controlled drugs within the clinical area? Or registered nurses? Charge nurse. Okay. Which of the following is not a part of the 6 rights of medication? That's the right route, the right dosage, right medication, right time, right reason, I think. Yes. Which of this medication is not to be administered with digoxin? Or is this digoxin or digoxin? Because I think I've been pronouncing it wrongly. Anyway, the answer should be corticosteroids or diuretics. What does digoxin do? Diuretics reduces fluid in the blood, thereby increasing the blood pressure and pulse. So I think that should be diuretics, or is it NSAIDs? Let's just go with NSAIDs. Describe the breathing pattern when a patient is suffering from opioid toxicity. I'm not so sure, so I'll just choose randomly. Slow and shallow, okay? Which of the following drugs will require 2 nurses to check during preparation and administration? That should be morphine tablet. Precise indicator of anticoagulation status when on oral. Ooh, why did they put this in abbreviation forms? I hate abbreviations form. I'm just going to go with PT and RNR. Honestly, I can't remember what it means, but I know that it has to do with either platelet testing or so. Mild pain after surgery, and pain is reduced by taking which medication? Could be with paracetamol. What fluid should ideally be used when irrigating eyes? Sterile, normal saline, or sterile water? Sterile water. All but one are signs of opioid toxicity. I think that should be tachycardia. Yes. Who is responsible for disposing sharps? The person who uses it. Which is the best site for giving IM injection on buttocks, upper outer chondrite? Everyone should know this. Which of the following cannot be seen in a depressed client? Increased energy. Definitely the person cannot be The person would be inactive, sad facial expression, slow monotonous speech, definitely not increased energy. The first techniques used to examine the abdomen of a client is palpitation. Is it inspection? Let's go with palpitation first. Auscultation. Yeah, auscultation is the answer. Common cause of airway obstruction in an unconscious patient is tongue falling back, oropharyngeal tumor, no. Laryngeal cyst, no. Foreign body obstruction, no. Tongue falling back. Which is not an expected side effect of lumbar tap? I think it should be nausea, swelling, and bruising. Yeah, headache. Okay, but there could be headache. I'm not so sure. Let me know what you think in the comment section. Which of the following senses is to fade last when a person dies? Of course, it's hearing. Patient says, I hate cancer. Why did God give it to me? Which state of grief is this? That is anger. Now, the final question says, a patient who refuses to believe a terminal diagnosis is exhibiting denial. Yes, and that's it. We scored 109 out of 120 questions.